One person. Please identify yourself before you talk.
Thank you, Chair. I'm Michael Grop with Medtronic, and I'd just like this audience to understand that there, in fact, is a large body of internationally recognized standards for medical devices. Mike Ward, in his remarks this morning, referred to the International Medical Devices Regulators Forum, and IMDRF has an ongoing work project to survey the current landscape of medical device standards and has identified, if memory serves, over 770 medical device standards. They cover a broad range of topics such as electrical safety, software safety, biocompatibility of materials used in standards, good clinical practices for medical device clinical trials, and so on. I believe that the speaker was referring to more specific performance standards for individual in vitro diagnostic tests, but it would be a significant misunderstanding to leave the impression that there are not standards in the domain of medical devices. And I would also note the Global Harmonization Task Force, which has been in existence for 20 years, now supplanted by International Medical Devices Regulators Forum, which have developed over the years over 20 harmonization guidance documents for the medical devices field, similar to those of ICH. Thank you.
May I just respond? I totally agree with you with respect to the existence and function of the IMDRF as well as GHTF. I believe that the focus of those organizations has been positive. When you look at the global perspective, however, I think there's room to encourage the inclusion of tools that need to be utilized in the low and middle income countries.
Thank you. Next question.
David Wood from World Health Organization. The theme of this session is gaps in harmonization or convergence activities. And one topic that we haven't perhaps discussed or considered is the resource that is needed to engage effectively with this activity. And I just wonder, is this, are the agencies sufficiently resourced or devoting sufficient resource to properly engage in international harmonization and convergent activities?
I believe the answer that I use is we work with the resources were made available to us. So of course we have to prioritize, and of course in the current environments we try to do that as thoughtfully as we possibly can. We'd like to do a great many things and probably won't be able to do all of them. Part of what's valuable in these couple days is helping to figure out how to identify those really high value things that one agency could make a big difference in if we were able to participate.
Yeah, I agree the resources remain a major issue. I think the PAHO construct and PANDRA is probably closest to, the adequate or reasonably optimum resources being available. It goes from that medium point to the other extreme end of donor-supported, foundation-supported, and philanthropy-supported resources, and the ones that are done by the governments themselves, like in the Gulf cooperation states. But I agree there's not a one approach to them, and the question is, what's the best scheme to consider? How do we prioritize what needs to be done first and get the resources together?
Okay, time for one last question.
Thank you very much. This is Michelle Forsley again from the O'Neill Institute on National and Global Health Law. Our topic this afternoon is gaps, and I've also listened today, and thank you all. I've heard a number of times that we don't have good information about the current legal infrastructure in countries, that there are gaps and inadequacies in the legal infrastructure to support the health system and the drug system. And I also observed that there's no lawyer on the panel except Tom, I think, is a lawyer. But we don't have a panel this afternoon for discussion on how are we going to address the gaps in the law, how are we going to build capacity in this area, and I'd like to make an argument right now that we add a seventh panel for this afternoon to talk about that. But also on the upcoming World Health Organization reform agenda is the subject of Article 23 of the Constitution. Members have an obligation to report their health legislation to WHO. Now, there's a bit of a slowdown in the system there given the retirement of staff, but it seems to me that part of this discussion should look at the question of how are we going to make it feasible for countries to report their health legislation so that it is accessible. There is no single repository in the world of this information. Current repositories are private and require membership of some sort. And so I'd like to hear what the panelists might have to say in terms of adding this very important tool of accessible health legal information to our toolbox to solve these problems we face, not just for harmonization, but for any of the problems we face in the health sector.
I'm going to take my prerogative here. I don't want us to get behind since we've got such an intense afternoon. So let me just hold that, give a quick answer, which is that I'm sure you're aware that the companies that are registering products all around the world, they know what's going on. So I'm agreeing with you. It would be very valuable to try to see if maybe there could be a little bit of collaboration and making the databases public if that's possible, considering they're not intrinsically trade secret. They're just collections of public documents and laws in countries where products are being registered. So no, you're shaking your head. Well, we don't have time to discuss it further. Hopefully later we'll be able to do that. And in terms of having an additional breakout group, I have no idea whether we have an extra room. Tracy's shaking her head. For our next meeting, we'll do that, and we'll see if we can get some of those. You created a fantastic opening for me to make a lawyer joke, but I'm going to decline that opportunity and march forward. We've got 5 breakout groups, as I said. If you haven't already signed up for one of them, feel free to join whichever one of them suits your fancy. I want to remind the rapporteurs in each group, and you know who you are, that we're going to expect you to come back in this room when we reconvene at 4:30 and report for 10 minutes each about what you heard. So thank you very much. In terms of instructions on where to go, Tracy, you want to?
We've indicated the rooms of each breakout session on the agenda. We do have maps outside, but in general, we have one group here. The next 2 groups are in the boardroom and in room 125. So if you go out of this room, take a right. They'll both be right there. The last 2 groups are in the members room in room 114. You have a little bit more of a walk. You have to go through the Great Hall as far as you can walk and then go left, but we can direct you. That's it.
Thank you.